And the number of positive cases and samples tested is noticeably on a decline. This is compared to 3 weeks ago. But this, the Ministry of Health warns, is in no way an indication that the curve is flattening. The ministry is reevaluating its testing strategy, focusing only on testing in the right places. This even as 271 new positive cases were reported, bringing the total number of cases to 30,636. Kenyans, however, are advised to be more concerned with the positivity rate rather than just the total number of positive cases and samples tested.
Kenya, by August 18th, Monday, had only carried out 398,585 cumulative tests for COVID-19. 30,636 people have tested positive from those tests. However, in the past week, the numbers of positive cases have steadily declined from 679 on Wednesday, 12th August, to 650 on the 13th, 580 on the next day, 271 on the 16th, 245 positive cases on Monday, 17th August, and 271 new positive cases from 4,019 samples Tuesday. What does this decline mean? Is our curve flattening?
But we must be very cautious before we start saying that our curve is flattening. We do not think so yet. We have to assess it further using other indicators.
Flattening the curve varies from counties. An example is Mombasa, which has seen a decline of cases, while Nairobi and Kiambu are on a high trajectory. Other indicators such as how many people die, how many people have to be hospitalized due to COVID-19 help to determine where we really are.
But the best indicator is the number of people who are in hospitals. When this starts going down and the deaths start going down, then we can probably start saying, yes, our curve is going down.
In the beginning of July, Kenya had only 6,673 confirmed COVID-19 cases. However, in this month, an average of 500 new cases were recorded, with high numbers such as 796 on July 23rd, 788 on 30th July, 723 on July 31st. By August 1st, 21,363 cases had been recorded. The increased testing was a step in the right direction in knowing the true trajectory of the pandemic, but with many challenges such as insufficient kits, inadequate labs and lab supplies in all counties, delays in turnaround for sample collection and results, the ministry is re-evaluating its testing strategy.
Our testing is now going to be targeted to areas that we feel are important, hotspots or areas that are high risk, and especially also in those groups of people who are considered to be at high risk, including our elderly and vulnerable people.
So, if testing reduces, how will public health officials know the infection rate? The test positivity rate then becomes a more useful measure rather than counting the total number of tests. The test positivity rate is simply the fraction of tests that come back positive. It is calculated by dividing the number of positive tests by the total number of tests. According to the World Health Organization (WHO), before a region can relax restrictions or begin reopening, the test positivity rate from a comprehensive testing program should be at or below 5% for at least 14 days.
By and large, our positivity rate has remained almost the same. So if you take 1,000 samples and 550 remain positive, that rate is to tell you that the positivity rate is still at where it was, at 5%.
If you get high test positivity, a high number of positive cases every time you test, it tells you that there's still more positive cases that have not yet been detected. High test positivity rates in some locations show that the virus is spreading. Likewise, testing needs to grow with it. On the other hand, if you test more people and get very few positive cases or low test positivity, it could tell you that most of the positive people have already been detected. The positivity rate helps inform both individual and government action. The Ministry of Health further warns that even if it is too early to know whether the curve is flattening, Kenyans should strictly observe the given guidelines, particularly the wearing of masks. Dorcas Wangira, Citizen TV, Nairobi.